Today we're going to be going over hypothyroidism. This is the second video in the clinical endocrinology series, and it comes after the first tutorial, which was on hyperthyroidism. So just as a quick recap, we're going to go over the structure and functions of the thyroid gland. As you can see from the image on the left, the thyroid gland is this structure which sits in front of the trachea and directly below the larynx, and it has multiple functions. For example, it's involved in metabolic rate control, it's involved in heart rate control, it has neural effects, and it's involved in bone and muscle health as well. And it's important to understand these functions because just like in hyperthyroidism, you can use these functions to work out the symptoms of hypothyroidism. So again, it's worth recapping the hypothalamus-pituitary-thyroid axis. We start with the hypothalamus, and this secretes a substance called TRH, or thyrotropin-releasing hormone. This TRH then acts on the anterior pituitary gland and causes it to secrete TSH, or thyroid-stimulating hormone. This TSH then acts on the thyroid gland and causes it to secrete T3 and T4. And the most important part of this whole axis is that it's governed by a negative feedback system. So basically, as the levels of T3 and T4 increase, it triggers the anterior pituitary gland to release less TSH and the hypothalamus to release less TRH. And that helps to keep the whole system in check. So when thinking about the causes of hypothyroidism, you can remember that something can go wrong with each stage of the axis. So for example, there could be hypothalamic or pituitary tumors, which decrease the levels of TRH and TSH, and that causes the levels of T3 or T4 to decrease downstream as well. There's also a condition known as Sheehan syndrome, and in this condition, there's excessive loss of blood following childbirth, and that results in the anterior pituitary gland not receiving enough oxygen, and consequently, it secretes less TSH and other pituitary hormones as well. Likewise, there could be problems directly with the thyroid itself, such as Hashimoto thyroiditis, subacute thyroiditis, which occurs after infections, and congenital thyroiditis. And finally, there could be problems such as iodine deficiency or antithyroid medication, which directly decrease the levels of T3 and T4. It's worth noting that the main cause of hypothyroidism in developed countries is Hashimoto thyroiditis, and the main cause in developing countries is iodine deficiency. And now we're going to discuss Hashimoto thyroiditis in a bit more detail. So Hashimoto thyroiditis is an autoimmune condition, and to fully comprehend it, we have to see what happens under normal circumstances. So in normal thyroid cells, we have an enzyme called thyroid peroxidase, and this adds iodine to a substance called thyroglobulin. And this is a key step in normal T3 and T4 production. In Hashimoto's thyroiditis, there can be autoantibodies against thyroid peroxidase, and this consequently results in less iodine incorporation into thyroglobulin, and therefore decreased levels of T3 and T4. There can also be autoantibodies against thyroglobulin directly, but the main result is the same. There are reduced serum levels of T3 and T4 following this autoimmune process. As I mentioned at the beginning, we can extrapolate from the normal functions of the thyroid to work out the signs and symptoms of hypothyroidism. So for example, one of the functions of the thyroid is metabolic rate control. And if this decreases too much, it can lead to weight gain and cold sensitivity. Another function of the thyroid is heart rate control. And if this decreases too much, it can lead to bradycardia. The thyroid also has multiple neural effects. So in hypothyroidism, there may be depression or fatigue. The thyroid is also involved in bone and muscle health. So if there's reduced thyroid activity, it can result in weakness and muscle aches. There are also some other symptoms of hypothyroidism, such as dry skin, brittle hair or nails, and irregular or heavy periods as well. In terms of diagnosis, there are some key investigations you can carry out to confirm hypothyroidism. For example, you can conduct thyroid function tests, And the way these work is that you measure the levels of TSH and T3 or T4 to work out the most likely diagnosis. And as you can see from the table, if your TSH is reduced and your T3 and T4 are reduced, then it suggests that there's a problem further up the axis. For example, a pituitary problem or a hypothalamus problem. If alternatively, your T3 or T4 are reduced, but your TSH is elevated, then it suggests that your pituitary gland is trying to influence your thyroid to secrete more T3 and T4, but it's unable to do so for some reason. And the most likely cause would be Hashimoto's thyroiditis here. You can also conduct antithyroid antibody screening, looking for the presence of antithyroid peroxidase antibodies or antithyroglobulin antibodies, and this can help to cement a diagnosis of Hashimoto's thyroiditis. In terms of the management for hypothyroidism, the mainstay of treatment is a drug called levothyroxine, or artificial T4. And this can be given as a once-daily oral hormone replacement regimen, and consequently helps to restore the levels of T3 and T4 in the blood. It's also worth knowing about a condition called myxedema coma, and this is basically a sudden exacerbation of hypothyroidism symptoms. So instead of cold intolerance, patients develop hypothermia and delirium. Instead of bradycardia, patients may develop cardiogenic shock. There may also be hypoglycemia and myxedema itself, which is basically a thickened, non-pitting edema of the skin. So how do we go about treating this? Well, the first step would be to treat the root cause using IV levothyroxine. IV hydrocortisone can also be given to help reduce inflammation. And finally, furosemide and mechanical ventilation may be required as well. So if you want to test your knowledge, we have a quick clinical case here. A 45-year-old female presents with weight gain, muscle aches, and cold sensitivity. On examination, she appears to have dry skin and brittle nails. Which investigation should be conducted for this patient? And the answer in this case would be thyroid function tests. And the reason for this is because we can see the classic symptoms of hypothyroidism. As a follow-up question, you refer her for thyroid function tests. What is the most likely diagnosis based on these findings? So I've included the normal values for TSH, T3, and T4, and the patient's values underneath in bold. And in this case, the most likely answer is Hashimoto's thyroiditis. And that's because we have a raised TSH of 10, which suggests that the pituitary gland is functioning normally. In other words, it's trying to stimulate the thyroid gland to secrete more T3 and T4. So just as a recap, if you have reduced T3 and T4 with a raised TSH, it suggests a primary problem with the thyroid, and the most likely diagnosis would be Hashimoto's thyroiditis. So here's just a quick summary slide outlining everything we've covered in this topic. If you have any questions, you can leave them in the comments below, and I'll try my best to get back to you. Thank you again for watching, and I'll see you in the next video.